Question 1. A nurse is caring for a client in the ICU who suddenly develops a blood pressure of 78/40 mm Hg, a heart rate of 132 per minute, and cool clammy skin. What is the nurse's priority action? A. Reassess in 30 minutes. B. Notify the healthcare provider immediately. C. Encourage oral fluids. D. Place the client in a chair. Correct answer, B. Rationale: the client is showing signs of shock and requires immediate intervention. Strategy: prioritize unstable vital signs and signs of poor perfusion. Question 2. A nurse is monitoring a client with septic shock. Which assessment finding indicates that treatment is effective? A. Urine output of 35 milliliters per hour. B. Blood pressure 80/40 mm of mercury. C. Cold extremities. D. Decreased level of consciousness. Correct answer, A. Rationale: adequate urine output indicates improved organ perfusion. Strategy: urine output is a key indicator of tissue perfusion. Question 3. A nurse is caring for a client receiving mechanical ventilation. Which assessment finding requires immediate intervention? A. Oxygen saturation of 86%. B. Temperature of 37 degrees Celsius 98.6 degrees Fahrenheit. C. Heart rate of 84 per minute. D. Blood pressure of 124/76 mmHg. Correct answer, A. Rationale: oxygen saturation below 90% indicates inadequate oxygenation. Strategy: airway and breathing always take priority. Question 4. A client with acute respiratory distress syndrome, ARDS, is receiving oxygen therapy. Which finding indicates worsening respiratory status? A. Increased restlessness. B. Improved appetite. C. Heart rate of 78 per minute. D. Warm skin. Correct answer, A. Rationale: restlessness is often an early sign of hypoxia. Strategy: mental status changes can signal decreased oxygenation. Question 5. A nurse is caring for a client with an arterial line. Which action is appropriate? A. Use the line for routine medication administration. B. Maintain a pressure bag on the flush system. C. Disconnect the tubing daily. D. Leave air bubbles in the system. Correct answer, B. Rationale: a pressure bag maintains continuous flow and prevents clot formation. Strategy: know the purpose and care of invasive monitoring devices. Question 6. A client develops ventricular tachycardia and has no pulse. What should the nurse do first? A. Check temperature. B. Begin CPR. C. Obtain a blood sample. D. Administer oral medication. Correct answer, B. Rationale: pulseless ventricular tachycardia is a cardiac arrest rhythm requiring immediate CPR. Strategy: follow the CAB approach during cardiac arrest. Question 7. A nurse is caring for a client with increased intracranial pressure, ICP. Which assessment finding requires immediate attention? A. Headache. B. Projectile vomiting. C. Bradycardia with hypertension. D. Mild anxiety. Correct answer, C. Rationale: bradycardia and hypertension are signs of worsening ICP and possible brain herniation. Strategy: recognize Cushing's triad as a neurological emergency. Question 8. A client with acute myocardial infarction reports chest pain rated 9 out of 10. What is the nurse's priority action? A. Assess vital signs and oxygenation. B. Offer a meal. C. Encourage ambulation. D. Reduce room lighting. Correct answer, A. Rationale: immediate assessment helps determine the client's stability and guides treatment. Strategy: assess before implementing interventions. Question 9. A nurse is monitoring a client receiving a vasopressor infusion. Which finding indicates the medication is effective? A. Blood pressure increases to target range. B. Respiratory rate decreases to 10 per minute. C. Temperature increases. D. Blood glucose decreases. Correct answer, A. Rationale: vasopressors are used to improve blood pressure and organ perfusion. Strategy: know the therapeutic goal of the medication. Question 10. A nurse is caring for a client with severe burns. Which assessment finding is the priority during the first 24 hours? A. Fluid volume status. B. Hair growth pattern. C. Sleep schedule. D. Nutritional preferences. Correct answer, A. Rationale: burn clients are at high risk for massive fluid loss and shock. Strategy: prioritize circulation and fluid balance. Question 11. A nurse is caring for a client admitted to the ICU following a severe traumatic brain injury. Which assessment finding is most concerning and may indicate increasing intracranial pressure? A. Glasgow Coma Scale score improving from 10 to 12. B. Blood pressure 180/90 mmHg and heart rate 48 per minute. C. Temperature 37.2 degrees Celsius 99 degrees Fahrenheit. D. Oxygen saturation 98%. Correct answer, B. Rationale: hypertension with bradycardia is part of Cushing's triad, indicating increased intracranial pressure. Strategy: watch for neurological changes and abnormal vital sign patterns. Question 12. A nurse is caring for a client who suddenly develops chest pain, shortness of breath, and oxygen saturation of 84%. Which action should the nurse take first? A. Administer oxygen. B. Obtain a weight. C. Offer oral fluids. D. Encourage deep breathing exercises only. Correct answer, A. Rationale: oxygenation is the priority in a client showing signs of respiratory compromise. Strategy: address airway and breathing before other interventions. Question 13. A nurse is monitoring a client receiving a continuous heparin infusion. Which laboratory value should the nurse monitor most closely? A. Hemoglobin A1C. B. Activated partial thromboplastin time, APTT. C. Potassium level. D. Calcium level. Correct answer, B. Rationale: APTT is used to evaluate the effectiveness and safety of heparin therapy. Strategy: know which laboratory values correspond with specific medications. Question 14. A client in septic shock has a blood pressure of 78/42 mmHg despite fluid resuscitation. Which medication would the nurse anticipate administering? A. Vasopressor infusion. B. Antacid therapy. C. Stool softener. D. Antihistamine. Correct answer, A. Rationale: vasopressors help maintain blood pressure when fluids alone are insufficient. Strategy: understand common treatments for shock states. Question 15. A nurse is caring for a client with acute respiratory distress syndrome, ARDS. Which assessment finding suggests worsening hypoxemia? A. Restlessness and confusion. B. Improved appetite. C. Blood pressure 120/70 mmHg. D. Heart rate 76 per minute. Correct answer, A. Rationale: mental status changes are often early signs of inadequate oxygenation. Strategy: monitor neurological status as an indicator of oxygen delivery. Question 16. A client with heart failure develops sudden severe respiratory distress and pink frothy sputum. What should the nurse suspect? A. Pulmonary edema. B. Pneumonia. C. Asthma attack. D. Gastritis. Correct answer, A. Rationale: pink frothy sputum is a classic sign of pulmonary edema. Strategy: recognize hallmark findings of life-threatening conditions. Question 17. A nurse is caring for a client whose cardiac monitor shows ventricular fibrillation. What is the priority intervention? A. Defibrillation. B. Obtain a blood pressure. C. Administer oral medication. D. Reposition the client. Correct answer, A. Rationale: ventricular fibrillation is a lethal rhythm requiring immediate defibrillation. Strategy: shockable rhythms require rapid defibrillation. Question 18. A client receiving mechanical ventilation suddenly has absent breath sounds on the right side and oxygen saturation drops to 82%. What should the nurse suspect? A. Pneumothorax. B. Hypertension. C. Constipation. D. Urinary retention. Correct answer, A. Rationale: sudden respiratory deterioration and unilateral absent breath sounds suggest pneumothorax. Strategy: assess for complications associated with mechanical ventilation. Question 19. A nurse is caring for a client after a major abdominal surgery. Which assessment finding requires immediate intervention? A. Urine output 15 milliliters per hour. B. Temperature 37 degrees Celsius 98.6 degrees Fahrenheit. C. Heart rate 82 per minute. D. Oxygen saturation 96%. Correct answer, A. Rationale: low urine output may indicate poor kidney perfusion or shock. Strategy: adequate urine output reflects organ perfusion. Question 20. A client is admitted with severe gastrointestinal bleeding. Which assessment finding indicates worsening shock? A. Cool clammy skin and tachycardia. B. Warm dry skin. C. Heart rate 70 per minute. D. Blood pressure 128/80 mmHg. Correct answer, A. Rationale: these findings indicate poor tissue perfusion and hypovolemia. Strategy: identify signs of circulatory collapse. Question 21. A nurse is caring for a client with multiple rib fractures. Which assessment finding is most concerning? A. Paradoxical chest movement during breathing. B. Pain score of 5 out of 10. C. Bruising over the ribs. D. Respiratory rate of 18 per minute. Correct answer, A. Rationale: paradoxical movement suggests flail chest, which can impair ventilation. Strategy: prioritize respiratory complications in chest trauma. Question 22. A nurse is monitoring a client with diabetic ketoacidosis, DKA. Which finding indicates improvement? A. Blood glucose level decreasing toward normal. B. Increasing ketones in urine. C. Worsening dehydration. D. Increasing respiratory rate. Correct answer, A. Rationale: lowering blood glucose and correcting metabolic abnormalities indicate improvement. Strategy: look for trends showing stabilization. Question 23. A client in the ICU develops a temperature of 39.8 degrees Celsius 103.6 degrees Fahrenheit, tachycardia, and altered mental status. What should the nurse do first? A. Notify the provider and begin sepsis protocol. B. Encourage ambulation. C. Offer snacks. D. Reduce room lighting. Correct answer, A. Rationale: these findings suggest sepsis and require immediate intervention. Strategy: recognize sepsis early and act quickly. Question 24. A nurse is assessing a client receiving blood transfusion therapy. Which finding suggests a transfusion reaction? A. Fever and chills. B. Improved blood pressure. C. Warm extremities. D. Increased appetite. Correct answer, A. Rationale: fever and chills are common signs of a transfusion reaction. Strategy: monitor closely during blood administration. Question 25. A nurse is caring for a client who suddenly becomes unresponsive and pulseless. What is the priority action? A. Begin CPR immediately. B. Document findings. C. Notify family members. D. Obtain laboratory samples. Correct answer, A. Rationale: immediate CPR improves the chance of survival. Strategy: in cardiac arrest, start CPR without delay. Question 26. A client with severe head trauma has a Glasgow Coma Scale score of 6. What does this indicate? A. Mild injury. B. Moderate injury. C. Severe neurological impairment. D. Normal neurological status. Correct answer, C. Rationale: a GCS score of 8 or less indicates severe brain injury. Strategy, no critical GCS ranges for NCLEX. Question 27. A nurse is caring for a client with acute kidney injury. Which assessment finding requires immediate reporting? A. Potassium level of 6.2 milliequivalent/L. B. Sodium level of 138 milliequivalent/L. C. Respiratory rate of 18 per minute. D. Temperature 36.8 degrees Celsius 98.2 degrees Fahrenheit. Correct answer, A. Rationale, severe hyperkalemia can cause life-threatening cardiac arrhythmias. Strategy, high potassium levels are always a priority. Question 28. A client receiving vasopressor therapy develops cold, pale fingers and toes. What is the nurse's best action? A. Assess peripheral circulation immediately. B. Encourage exercise. C. Offer oral fluids. D. Reassure the client only. Correct answer, A. Rationale, vasopressors can reduce blood flow to extremities. Strategy, monitor for complications of high-alert medications. Question 29. A nurse is caring for a client with severe pneumonia whose oxygen saturation continues to decline despite oxygen therapy. What intervention should the nurse anticipate? A. Mechanical ventilation. B. Discontinuation of oxygen. C. Oral antibiotics only. D. Increased activity. Correct answer, A. Rationale, mechanical ventilation may be necessary when oxygenation cannot be maintained. Strategy, escalate respiratory support when oxygen therapy is ineffective. Question 30. A nurse is caring for a client with septic shock who is receiving aggressive treatment. Which assessment finding best indicates improved tissue perfusion? A. Urine output of 40 milliliters per hour. B. Blood pressure 82/40 millimeter of mercury. C. Cool mottled skin. D. Decreased level of consciousness. Correct answer, A. Rationale, adequate urine output is one of the best indicators of organ perfusion. Strategy, evaluate kidney function when assessing perfusion status. Question 31. A nurse is caring for a client in the ICU who has a central venous catheter. Which assessment finding requires immediate intervention? A. Redness and drainage at the insertion site. B. Dry, intact dressing. C. Blood return from the catheter. D. Transparent dressing in place. Correct answer, A. Redness and drainage at the insertion site. Rationale, redness and drainage at the insertion site may indicate a catheter-related bloodstream infection. These infections can quickly become life-threatening, especially in critically ill clients. Early identification and treatment are essential to prevent sepsis and further complications. Strategy, when assessing invasive lines, always prioritize signs of infection, bleeding, or loss of catheter integrity. Question 32. A nurse is caring for a client with a pulmonary embolism. Which assessment finding is expected? A. Sudden shortness of breath and chest pain. B. Bradycardia and hypertension. C. Increased appetite. D. Warm flushed skin. Correct answer, A. Sudden shortness of breath and chest pain. Rationale, pulmonary embolism occurs when a clot blocks blood flow in the lungs. Classic symptoms include sudden dyspnea, chest pain, tachycardia, and decreased oxygen saturation. Strategy, for NCLEX questions involving pulmonary embolism, think sudden respiratory distress and chest pain. Question 33. A client receiving mechanical ventilation becomes increasingly agitated and attempts to remove the endotracheal tube. What should the nurse do first? A. Assess oxygenation and ventilator function. B. Apply restraints immediately. C. Leave the room briefly. D. Administer oral medication. Correct answer, A. Assess oxygenation and ventilator function. Rationale, agitation in a ventilated client may indicate hypoxia, discomfort, pain, or ventilator malfunction. Strategy, sudden behavioral changes often signal physiological problems. Assess before acting. Question 34. A nurse is caring for a client with severe sepsis. Which laboratory result should the nurse recognize as most concerning? A. Elevated lactate level. B. Sodium 140 milliequivalent/L. C. Hemoglobin 13G/DL. D. Platelets 250,000/mm superscript 3. Correct answer, A. Elevated lactate level. Rationale: elevated lactate levels indicate poor tissue perfusion and anaerobic metabolism. Strategy: in sepsis questions, elevated lactate is a key indicator of severity. Question 35. A nurse is caring for a client after open-heart surgery. Which finding should be reported immediately? A. Chest tube drainage of 250 milliliters in 1 hour. B. Heart rate of 88 per minute. C. Blood pressure of 118/70 mmHg. D. Oxygen saturation of 96%. Correct answer, A. Chest tube drainage of 250 milliliters in 1 hour. Rationale: excessive chest tube drainage may indicate postoperative hemorrhage requiring immediate intervention. Strategy: postoperative bleeding is always a priority concern. Question 36. A client with acute kidney injury has absent urine output for the last 4 hours. Which complication is the nurse most concerned about? A. Hyperkalemia. B. Hypoglycemia. C. Hypercalcemia. D. Leukopenia. Correct answer, A. Hyperkalemia. Rationale: kidney failure can cause potassium to build up, leading to dangerous cardiac arrhythmias. Strategy: think potassium first in kidney failure questions. Question 37. A nurse is caring for a client with increased intracranial pressure. Which nursing action is appropriate? A. Maintain the head of the bed at 30 degrees. B. Place the client flat. C. Encourage frequent coughing. D. Flex the client's neck. Correct answer, A. Maintain the head of the bed at 30 degrees. Rationale: elevating the head promotes venous drainage and helps reduce ICP. Strategy: choose interventions that decrease pressure in the brain. Question 38. A client develops sudden hypotension during hemodialysis. What is the nurse's priority action? A. Stop ultrafiltration and assess the client. B. Encourage ambulation. C. Provide a large meal. D. Raise the room temperature. Correct answer, A. Stop ultrafiltration and assess the client. Rationale: rapid fluid removal can cause hypotension during dialysis. Strategy: address sudden vital sign changes immediately. Question 39. A nurse is caring for a client receiving total parenteral nutrition, TPN. Which complication should the nurse monitor for most closely? A. Hyperglycemia. B. Hypothermia. C. Bradycardia. D. Hypertension. Correct answer, A. Hyperglycemia. Rationale: TPN contains a high concentration of glucose, increasing the risk of elevated blood sugar. Strategy: think glucose monitoring whenever TPN is mentioned. Question 40. A client in the ICU develops sudden confusion, tachycardia, and oxygen saturation of 82%. What is the nurse's priority action? A. Administer oxygen immediately. B. Offer oral fluids. C. Reassure the client. D. Reduce room noise. Correct answer, A. Administer oxygen immediately. Rationale: an oxygen saturation of 82% indicates severe hypoxemia requiring immediate treatment. Strategy: follow ABCs, airway and breathing come first. Question 41. A nurse is assessing a client with cardiogenic shock. Which finding is expected? A. Cool clammy skin and hypotension. B. Warm dry skin. C. Hypertension and bradycardia. D. Increased urine output. Correct answer, A. Cool clammy skin and hypotension. Rationale: poor cardiac output causes decreased tissue perfusion and low blood pressure. Strategy: think poor pump equals poor perfusion. Question 42. A client with ARDS has worsening blood gases despite oxygen therapy. Which intervention should the nurse anticipate? A. Endotracheal intubation and mechanical ventilation. B. Oral antibiotics only. C. Fluid restriction alone. D. Increased ambulation. Correct answer, A. Endotracheal intubation and mechanical ventilation. Rationale: mechanical ventilation may be necessary when oxygen therapy is no longer effective. Strategy: if oxygen isn't enough, think advanced airway support. Question 43. A nurse is caring for a client who develops ventricular tachycardia with a pulse. What is the priority action? A. Assess stability and prepare for treatment. B. Encourage oral fluids. C. Obtain a urine specimen. D. Place the client in Trendelenburg position. Correct answer, A. Assess stability and prepare for treatment. Rationale: ventricular tachycardia can quickly become life-threatening if not treated. Strategy: determine whether the client is stable or unstable. Question 44. A client with severe burns has a urine output of 10 milliliters per hour. What does this finding indicate? A. Inadequate tissue perfusion. B. Improved kidney function. C. Normal fluid balance. D. Excess hydration. Correct answer, A. Inadequate tissue perfusion. Rationale: low urine output suggests poor blood flow to the kidneys. Strategy: urine output is a key indicator of organ perfusion. Question 45. A nurse is caring for a client receiving blood products. Which symptom suggests an acute hemolytic transfusion reaction? A. Fever, chills, and back pain. B. Increased appetite. C. Dry skin. D. Bradycardia. Correct answer, A. Fever, chills, and back pain. Rationale: these are classic signs of a hemolytic transfusion reaction. Strategy: stop the transfusion immediately if a reaction is suspected. Question 46. A client with septic shock begins producing 45 milliliters of urine per hour. What does this finding suggest? A. Improved tissue perfusion. B. Worsening kidney failure. C. Increased intracranial pressure. D. Fluid overload. Correct answer, A. Improved tissue perfusion. Rationale: adequate urine output indicates improved blood flow to the kidneys. Strategy: monitor urine output to evaluate shock treatment. Question 47. A nurse is caring for a client with a tension pneumothorax. Which assessment finding would the nurse expect? A. Tracheal deviation and severe respiratory distress. B. Increased bowel sounds. C. Bradycardia and hypertension. D. Improved oxygen saturation. Correct answer, A. Tracheal deviation and severe respiratory distress. Rationale: air trapped under pressure causes respiratory compromise and tracheal shift. Strategy: severe respiratory distress plus tracheal deviation equals tension pneumothorax. Question 48. A client develops sudden chest pain and ST segment elevation on the ECG. What should the nurse suspect? A. Acute myocardial infarction. B. Asthma exacerbation. C. Pneumonia. D. Gastritis. Correct answer, A. Acute myocardial infarction. Rationale: ST segment elevation is a hallmark sign of an acute STEMI. Strategy: associate ST elevation with myocardial infarction. Question 49. A nurse is caring for a client receiving vasopressor therapy. Which assessment finding indicates that the medication is effective? A. Mean arterial pressure reaches the prescribed goal. B. Heart rate decreases to 40 per minute. C. Temperature increases by 2 degrees Celsius. D. Appetite improves. Correct answer, A. Mean arterial pressure reaches the prescribed goal. Rationale: vasopressors are used to improve blood pressure and organ perfusion. Strategy: focus on the intended effect of the medication. Question 50. A nurse is caring for a critically ill client who suddenly becomes pulseless and apneic. What is the nurse's priority action? A. Begin high-quality CPR immediately. B. Obtain a blood pressure reading. C. Notify family members. D. Complete documentation. Correct answer, A. Begin high-quality CPR immediately. Rationale: immediate CPR improves circulation and survival during cardiac arrest. Strategy: in cardiac arrest, CPR is always the first priority.